nurse called the doctor while he is at home when she asked him for an order for patient's medication. As a nurse, how many hours must the doctor took to write in the hospital documentation? A. 6 hours. B. 24 hours. C. 48 hours. D. 12 hours. The answer is B. 24 hours. A handbook of nursing research emphasizes on comprehensive reading and summarizing of previous publications related to the topic. Which of the following is the component of this research? A. Literature review. B. Systematic review. C. Discussion of results. D. Referencing. The answer is A. Literature review. A 25-year-old female patient is admitted to the surgical ward for the repair of her umbilical hernia. Her initial assessment revealed that she belonged to the lower socioeconomic group and she had 4 sisters and 1 brother. All of them were uneducated. She was living in a small house of 2 bedrooms and 1 bathroom. The main source of her family income was through farming, and the only breadwinner is the family is the father. What type of information can this be categorized as? A. Patient's family status. B. Personal information. C. Economic background. D. Demographic information. The answer is D. Demographic information. An infant was admitted with patent ductus arteriosus, indomethacin 0.2 mg per kilo with prostaglandin inhibitor via intravenous route was prescribed for him. Which of the following is the function of indomethacin? A. Assist closure of ductus arteriosus. B. Prevent infection. C. Improve tissue perfusion. D. Preserve hormone level. The answer is A. Assist closure of ductus arteriosus. A newborn is diagnosed with ventricular septal defect or VSD. Which of the following information should the nurse give to the newborn's mother? A. Cyanosis will occur most of the time during sleeping. B. Breastfeeding is not recommended for your child. C. The defect might close spontaneously after 6 months. D. Blood pressure is different on the child's arm and leg. The answer is C. The defect might close spontaneously after 6 months. A newborn is admitted to NICU with tracheoesophageal fistula or TOF. Which of the following nursing interventions should be included? A. Elevate the head for feedings. B. Elevating the head but keep the child in PO. C. Insert a nasogastric tube for feeding. D. Encourage the mother to breastfeed. The answer is B. Elevating the head but keep the child in PO. A 63-year-old man patient is admitted to the emergency department with complaints of severe chest pain. The apical pulse is the most appropriate site to obtain the accurate heartbeats. Where should the nurse place the stethoscope to obtain the apical pulse? A. In the middle of the chest between the nipples. B. Over the apex of the heart between 4th and 5th rib. C. Between 5th and 6th rib slightly above the nipples. D. Between 5th and 6th rib, the mid-clavicle line below the nipple. The answer is B. Over the apex of the heart between 4th and 5th rib. A 58-year-old woman presents to a clinic with tiredness and weakness. She is tired throughout the day and usually sleeps for in and mid-afternoon. The last bowel movement was 4 days, has a prescription for levothyroxine, but says she doesn't remember to take it as prescribed. The doctor arranged for specimen to be sent to the laboratory. Which laboratory test results are most likely? A. Increased T4 and decreased TSH. B. Increased T4 and TSH unchanged. C. Decreased T4 and TSH increase. The answer is C. Decreased T4 and TSH increase. A nurse is caring for an elderly bedridden patient who is dependent on staff most activities of daily living. There is an order for standard precautions in the patient's chart. The patient's care plan includes feeding, washing hair with dry shampoo, brushing teeth, and nail care. Which of the following activities would require precaution? A. Brushing teeth. B. Feeding. C. Hair washing. D. Nail care. The answer is A. Brushing teeth. Staff reports to a charge nurse that they suspect temperature are being incorrectly measured by a certain machine. Which of the following action is the best for the charge nurse to check? A. At those taking vital signs to compare results to different machines. B. Tell staff to obtain a machine another unit and use to take temperature. C. Spend time at shift change to personally assess the accuracy of machines. D. Call maintenance department and ask them to pick up a machine for repair. The answer is A. Ask those taking vital signs to compare results to different machines. Following a lumbar puncture, a patient has several complaints. Which of the following complaints indicate that patient is experiencing a complaint? A. I have a headache that gets worse when I sit up. B. I am having pain in my lower back when I move my legs. C. My throat hurts when I swallow. D. I feel sick to my stomach and I am going to throw up. The answer is A. I have a headache that gets worse when I sit up. Upon reviewing the pregnant client's blood test results, the traces of mercury are present even after the nurse had healthy dietary modifications. Which action of the client does the nurse discuss to reduce the risk to the client? A. Client has 5 soaked walnuts every day. B. Clients consumes king mackerel very often. C. Clients eats 1 medium bowl of flax seeds daily. D. Client has cooked soybean seeds as an evening snack. The answer is B. Client consumes king mackerel very often. Fish that contain high levels of mercury include sharks, ray, swordfish, barramundi, gemfish, orange ruffling, southern bluefin tuna. The mercury is a naturally occurring element that is found in air, water, and food. However, nearly all fish and shellfish contain traces of mercury. For most people, the risk from mercury by eating fish and shellfish is not a health concern. Yet, some fish and shellfish can contain higher levels of mercury that may harm an unborn baby or young child's developing nervous system. A second day post-delivery, which blood color will be the lochia? A. Lochia rubra. B. Lochia serosa. C. Lochia alba. The answer is A. Lochia rubra. In Lochia rubra, it is dark red color for 3 to 4 days. Lochia serosa is pinkish brown 4 to 10 days. Lochia alba is whitish yellow 10 to 28 days. What is the site of ileostomy? A. Left lower. B. Right lower. C. Left upper. D. Right upper. The answer is B. Right lower. A 60-year-old woman was admitted with chronic pulmonary disease associated with carbon dioxide retention. The patient is on nasal prong 3 liters per minute. Which of the following is the potential risk this patient if excessive oxygen is administered? A. Apnea. B. Hypoxemia. C. Hypercapnia. D. Pulmonary edema. The answer is C. Hypercapnia. Giving oxygen to someone with COPD can sometimes make hypercapnia worse. This is because it can increase VQ mismatch or cause your blood cells to release more carbon dioxide into your blood that your body cannot effectively get rid of. When you have COPD, too much oxygen could cause you to lose the drive to breathe. If you get hypercapnia but it isn't too severe, your doctor may treat it by asking you to wear a mask that blows air into your lungs. A postpartum woman who was admitted for 24 hours, community nurse visited her after 2 days of discharge. Which of these are abnormal findings? A. Frequent urination. B. Lochia serosa. C. Uterus below symphysis pubis. D. Breast full of milk. The answer is C. Uterus below symphysis pubis. You have learned that in babies and children with developmental dysplasia of the hip, DDH, The hip joint has not formed normally. Which of the following is the most common form of DDH? A. Acetabular dysplasia. B. Dislocation. C. Prelocation. B. Subluxation. The answer is D. Subluxation. Subluxation is the medical term for a partial dislocation. Children with cerebral palsy, 30 to 50% have cognitive impairment. Which of the following is the main role of the charge nurse? A. Patient are reassessed at appropriate intervals. B. Provide enough equipment and supplies. C. Assess patient regularly for pain. D. Coordinate patient care. The answer is D. Coordinate patient care. Charge nurse hears a nurse speaking to a patient with disrespect. Which of the following is the best action for the charge nurse? A. Apologize to the patient. B. Tell nurse to be kind. C. Take over the care. D. Speak privately with the nurse. The answer is D. Speak privately with the nurse. Which of the following patient is most appropriate to care first? A. Patient with a central venous catheter inserted 4 hours ago. B. Paralyzed patient who has had continued tube feeding. C. Adolescent patient who had appendectomy 1 day ago. D. Gastrectomy patient who came from post-operative care unit 1 hour ago. The answer is D. Gastrectomy patient who came from post-operative care unit 1 hour ago. Which of the following nursing intervention assists in the prevention of pressure ulcers following abdominal surgeries? A. Frequent surgery observation in the site every 2 hours. B. Frequent moisturizing of skin. C. Use side rails as restraints. D. Encourage ambulation. The answer is D. Encourage ambulation. The nurse is preparing the patient for hospital for discharge following above knee amputation with rigid dressing over the residual limb. 14 days following surgery, the patient is successfully fitted with prosthetic limb and begin physical therapy. Which of the following resting position is most beneficial? A. Sitting with legs crossed. B. Abduction of residual limb. C. Knee flexion when sitting in chair. D. Knee extension when in the bed. The answer is D. Knee extension when in the bed. A client has just returned to a nursing unit after an above-knee amputation of the right leg. The nurse should place the client in which position? A. Prone. B. Reverse Trendelenburg's. C. Supine with the amputated limb flat on bed. D. Supine with the amputated limb supported with pillows. The answer is D. Supine with the amputated limb supported with pillows. A patient was admitted to burn unit 12 hours ago with deep partial thickness burns. Which of the following would be expected to be seen? A. Increased body temperature. B. Increased hematocrit level. C. Increased blood pressure. D. Increased urine output. The answer is B. Increased hematocrit level. Does hematocrit level increase with burns? The hematocrit is the percentage of the body volume of the whole blood that is made up of red blood cells. In burn patients, the patient has lost a lot of fluid from leaky blood vessels. There are more red cells than fluid, so the hematocrit is high. Patient with ABG of pH 7.33, bicarbonate is 30, the PCO2 is 50. A. Compensated respiratory acidosis. B. Compensated metabolic alkalosis. C. Uncompensated respiratory alkalosis. D. Uncompensated respiratory acidosis. The answer is D. Uncompensated respiratory acidosis. The most common cause for acute renal failure: A. Pyelonephritis. B. Tubular destruction. C. Urinary tract obstruction. D. Dehydration. The answer is D. Dehydration. Health education about accident in school. Role of who? A. Nurse. B. Doctor. C. Social worker. D. Administrator. The answer is A. Nurse. The patient changed his mind after informed consent was done. What principle is linked to this patient right? A. Justice. B. Competence. C. Autonomy. D. Beneficence. The answer is C. Autonomy. A patient treated an insect bite with traditional alternative therapy of raw garlic juice caused strong skin reaction. The patient agreed not to use it again after the nurse explained its harmful effects. Which of the following is the best expression of the nurse role? A. Patient's advocate. B. Resource person. C. Care planning. D. Caregiver. The answer is D. Caregiver. After the pericardiocentesis, the doctor inserted a polyethylene catheter, left it in the pericardial sac. The patient asked the nurse about the response of the catheter. What should the nurse response? A. Monitor consistency of drainage. B. Prevent movement of pericardial sac. C. Prevent recurrence of cardiac tamponade. D. Prevent increase in venous and blood pressure. The answer is A. Monitor consistency of drainage. A 53-year-old was referred to the emergency department by the primary health center nurse for hyperglycemia. The nurse interviews him and finds out that he has been recently diagnosed with diabetes. He says that he does not understand why he needs insulin. The test glucose fasting result is 12.2. The normal values is 3.5 to 6.5 millimole per liter. Which of the following learning needs is indicated for this patient? A. Insulin alternatives. B. Complications of diabetes. C. Disease process of diabetes. D. Lifestyle and dietary changes. The answer is C. Disease process of diabetes. Which patient is contraindicated for enema? A. Glaucoma. B. Hypertensive. C. Renal failure. D. Liver disease. The answer is C. Renal failure. In patients with renal failure, such enemas can produce severe hyperphosphoремia. For bowel cleansing, thus constitutes an acute phosphate load. When renal function is impaired, however, the phosphate load becomes clinically significant and life-threatening that cause hyperphosphatemia can develop. A 40-year-old woman presents to the clinic with cramping abdominal pain that comes and goes every 5 to 10 minutes. She is unable to pass gas or stool. The abdomen appears greatly distended. On auscultation, bowel sounds are quiet and hypoactive. On percussion, there is resonance. On palpation, the abdomen examination is performed and the rectum is found to be empty, is tender without guarding. Which of the following health problems would be most likely? A. Diverticulitis. B. Obstruction. C. Appendicitis. D. Crohn's disease. The answer is B. Obstruction. A 69-year-old obese woman with past medical history of peptic ulcer disease underwent an urgent laparoscopy, lobe ileostomy with intraoperative colonic lavage without complication. On discharge plan, the nurse explained several instructions. Which of the following symptoms the nurse should instruct the client to report immediately? A. Temperature of 37.6 degrees Celsius. B. Passage of liquid stool in the stomach. C. Occasional presence of undigested food. D. Absence of drainage from the ileostomy for 6 or more hours. The answer is D. Absence of drainage from the ileostomy for 6 or more hours. A 70-year-old woman is admitted to the cardiac care unit with new onset of atrial fibrillation and is receiving intravenous diltiazem and heparin. What is the most likely nursing diagnosis? A. High risk for infection. B. High risk for impaired gas exchange. C. High risk for decreased cardiac output. D. High risk for disturbed sensory perception. The answer is C. High risk for decreased cardiac output. The primary care nurse in the cardiac care unit provided care for a patient with myocardial infarction with chest pain. Which activity is related to nursing planning? A. Administer morphine as prescribed. B. Assess the level of pain management. C. Clearly state the nursing diagnosis as pain. D. Determine a set nursing intervention outcomes for pain. The answer is A. Administer morphine as prescribed. A 21-year-old woman patient was admitted in the psychiatric ward for her panic anxiety attacks. She was mostly quiet and unsocial, but her assigned nurse gradually developed a trusted relationship with her. In one of the interactions with the nurse, she asked about how she could improve her behavior with her mother, as regardless of anyone's fault, she yells and even hit her mother. What should be the main emphasis for health education of the patient? A. Social interaction. B. Family counseling. C. Role and relationship. D. Coping stress tolerance. The answer is D. Coping stress tolerance. A nurse is discharging a patient after hospitalization due to the myocarditis. Which of the following statements should be included in discharge teaching? A. There is usually some residual heart enlargement. B. May resume previous activities as before hospitalization. C. Avoid immunization against infectious disease. D. Rapid beating heart is a common side effect of the illness and is not dangerous. The answer is A. There is usually some residual heart enlargement. While undergoing a Scfhs enema, the client complains of abdominal cramping. The nurse should A. Immediately stop the infusion. B. Lower the height of the enema container. C. Advance the enema tubing 2 to 3 inches. D. Clamp the tubing. The answer is B. Lower the height of the enema container. A 40-year-old woman presents with painful leg cramps and muscle twitching, which wakens her at night. Her menstrual cycles are irregular and cause painful abdominal cramping. The hair, skin, and nails appears to be dry and brittle. The test results normal values. Calcium result is 2.09. The normal values is 2.15 to 2.62 millimole per liter. Phosphate 6.69 result. The normal values is 0.82 to 1.51. What type of lifelong diet would be most beneficial for this patient? A. Increase magnesium and vitamin C. B. Increase calcium and vitamin D. C. Increase dairy and iron. D. High protein and high calorie. The answer is B. Increase calcium and vitamin D. A patient comes to the emergency department after falling out. The nurse notices that the patient's left leg is externally rotated shorter than the right leg. The patient cannot move the left, complains of severe pain. What is the most likely cause of these symptoms? A. Dislocated patella. B. Fractured left hip. C. Fractured left tibia. D. Dislocated left fibula. The answer is B. Fractured left hip. The nurse is assessing a young adult pregnant client with no allergies who has tested positive of gonorrhea. Which of the following medications should the nurse expect to be part of the treatment plan? A. Tetracycline. B. Ciprofloxacin. C. Azithromycin. D. Ceftriaxone. The answer is D. Ceftriaxone. A pregnant mother at early pregnancy was admitted in emergency room with leakage of amniotic fluid, vaginal bleeding, and lower abdominal cramping pain. What is the possible diagnosis should the nurse suspect? A. Missed. B. Inevitable. C. Incomplete. D. Threatened. The answer is B. Inevitable. The causes of spontaneous abortion. Genital anomalies. Which of the following conditions would be most appropriately cared for by a telemetry unit nurse? The answer is new onset of atrial fibrillation. Telemetry nurses are registered nurses who are trained to use and read an electrocardiogram or ECG or EKG and telemedicine technology to effectively monitor a patient's vital signs and identify any irregular heart rhythm. While a nurse is having a conversation with a patient about his daily life routine, she noticed that he moved closer to her body and made her feel tense. Which of the following is the most appropriate response? A. Yell and send him to his room. B. Change the topic of conversation. C. keep silent and step back. D. Appear uncomfortable and limit behavior. The answer is D. Appear uncomfortable and limit behavior. A head nurse of coronary care unit delegated staff scheduling to a senior nurse in that unit. Which of the following steps must be the head nurse implement before delegating tasks? A. Negotiate with the senior. B. Take signature of the senior. C. Explain tasks to the senior. D. Make sure hospital policies for delegating tasks. The answer is D. Make sure hospital policies for delegating tasks. Which of the following describes functional nursing? A. Task and activity-oriented care. B. Involves a group of nurses working together to identify, plan, implement, and evaluate patient-centered care. C. Ratio of patient care. D. Emphasizes on continuity of care responsibility. The answer is A. Task and activity-oriented care. The functional nursing, also known as task nursing, focuses on the distribution of work based on their performance of tasks and procedures, where the target of the action is not the patient but rather the task. The nurse is caring for a client who had sustained a head injury vehicle accident. In the follow-up visit, the client appears disoriented and is unable to recall recent events. When asking details, the client responds by talking about the weather. Which of the following is most likely additional clinical findings? A. Dryness of the face. B. Increase in heart rate. C. Constriction of pupils. D. Decrease in blood pressure. The answer is C. Constriction of pupils. A 10-year-old child admitted to the pediatric ward with rheumatic fever. Which assessment data should the nurse consider when obtaining child's history to be most significant? A. Family history of congenital heart disease. B. Recent episodes of streptococcus tonsillitis. C. Lack of interest in certain types of food. The answer is B. Recent episode of streptococcus tonsillitis. What is the important considerations that the nurse must check after the placenta is delivered? A. Check if the cord is long enough for the baby. B. Check if the umbilical cord has 3 blood vessels. C. Check if the cord has a meaty portion for a shiny portion. D. Check if the placenta is complete, including the membranes. The answer is D. Check if the placenta is complete, including the membranes. A patient with an allergy to cats arrives at the emergency department with symptoms of pruritus and difficulty swallowing after visiting some who has 3 cats. Addition to confirming airway patency, which of the following is the most appropriate to prepare for the patient? A. Intravenous line insertion. B. Intravenous glucocorticoid. C. Subcutaneous epinephrine. D. Application of ice throat. The answer is C. Subcutaneous epinephrine. A 25-year-old patient is admitted for observation in the surgical unit with a concussion after being involved in the road traffic accident. A nurse performed a routine neurological assessment and notes a decrease in the patient's level of consciousness. The BP is 170/110. The heart rate is 52. The respiratory is 11. The autosaturation is 93%. Which of the following is the most likely cause? A. Hypovolemia. B. Hypothermia. C. Pulmonary embolism. D. Increased intracranial pressure. The answer is D. Increased intracranial pressure. A full-term newborn admitted to the neonatal intensive care unit with diagnosis of tracheoesophageal fistula. Which of the following nursing measures to prevent pulmonary complications and improve good prognosis of the newborn condition? A. Encourage exclusive breastfeeding. B. Insert nasogastric tube for gastric decompression. C. Intermittent suction by double lumen catheter. D. Prepare for the insertion of tracheostomy. The answer is C. Intermittent suction by double lumen catheter. ECG showed ST elevation. To confirm diagnosis of MI, the nurse expect to do A. Troponin level. B. Cardiac catheterization. C. ECG. The answer is A. Troponin level. Ovulation occurs 14 days before the onset of the next menstrual cycle. General knowledge. Question. A 71-year-old woman who resides in a long-term nursing home fell while walking downstairs. The attending nurse arrives to find the patient sitting motionless on the stairs. She is alert and oriented but wishes to rest. While she is resting, the nurse reviews the chart and notes that her medication regimen includes metformin, loratadine, warfarin, and diclofenac. Which medication is most likely to increase the patient risk for injury? A. Metformin, B. Loratadine, C. Warfarin, D. Diclofenac. The answer is loratadine. An 80-year-old man has Alzheimer's disease and increasingly has frequent periods of dementia, during which he doesn't remember family members' names and is not oriented to person, place, and time. The healthcare provider speaks with the man's sons about becoming the medical power of attorney for his father, who is no longer able to do this for himself. Which two elements of informed consent does the father lack? A. Autonomy and fidelity. B. Confidentiality and justice. C. Competence and comprehension. D. Voluntariness and veracity. The answer is A. Autonomy and fidelity. The home care nurse is providing wound care for a patient. The nurse evaluates the wound and notes the presence of granulation tissue in the wound bed. This observation presents which phase of wound healing? A. Maturation. B. Inflammation. C. Proliferation. D. Finalization. The answer is C. Proliferation. A 45-year-old immigrant from Southeast Asia is administered a Mantoux test. He has no significant health history and shows no symptoms of active cough, night sweats, fatigue, and weight loss. 72 hours after the subcutaneous injection, there is a wheal of 6 mm diameter at the site. A sputum sample and blood samples are collected for analysis. X-ray shows clear lung fields with an absence of infiltrates bilaterally. Which of the following would be suspected? A. Active tuberculosis. B. BCG1 vaccination. C. HIV infection. D. Reactivation. The answer is B. BCG vaccination. A community health nurse was evaluating a DOT program for a pulmonary tuberculosis patient. What is the aim of DOT program? A. Assess family support. B. Evaluate nutritional status. C. Monitor home environment. D. Prevent antibiotic resistance. The answer is D. Prevent antibiotic resistance. What is DOT program? It is Directly Observed Treatment. It is a short course, also known as TB DOTS, is the name given to the tuberculosis control strategy recommended by WHO. What is the aim of that program? The DOTS program helps in several ways. The healthcare provider can help the TB patient remember to take the medicines and complete the treatment. This means he or she will get well soon as possible. The healthcare worker will make sure that the medicines are working as they should. Directly observed treatment, or DOT, is the practice of observing a patient swallow his or her tuberculosis medication. What is Raynaud's disease? Raynaud's phenomenon is a problem that causes decreased blood flow to the fingers. In some cases, it also causes less blood flow to the ears, toes, nipples, knees, or nose. This happens because of spasm of blood vessels in those areas. The spasm happen in response to cold, stress, or emotional upset. Experts don't fully understand the cause of Raynaud's attacks, but blood vessels in the hands and feet appear to react too strongly to cold temperatures or stress. Weber test. How is the Weber test done? By placing a vibrating tuning fork on the patient's forehead midline, where you can hear a buzzing noise. The nurse is performing a physical examination to client with hearing difficulties. The nurse activated the tuning fork and placed it on top of the patient's head. What test did the nurse perform? A. Whisper test. B. Rhine test. C. Odometer test. D. Weber test. The answer is D. Weber test. The site of the Weber test is A. Occipital bone. B. Bilateral bone. C. Mastoid bone. D. Midline of forehead. The answer is D. Midline of forehead. At 6 p.m., while admitting a woman for scheduled repeat cesarean section, a patient tells a nurse that she drank a cup of coffee at 4 a.m. because she wanted to avoid getting a headache. Which of the following actions should you take first? A. Inform anesthesia care provider. B. Ensure perioperative lab results are available. The answer is A. Inform anesthesia care provider. A nurse is caring for a patient with liver cirrhosis observes the following laboratory result. The sodium is 130, the normal is 134 to 146, the potassium is 3 and the normal is 3.5 to 5.0, the chloride is 98 and the normal is 97 to 108, ammonia is 32.1 and the normal is 9 to 33. Which of the following is the most likely plan based on ammonia level? A. Encourage high protein intake. B. Restrict high vitamin C fluids. C. Restrict high protein intake. D. Encourage high vitamin C food. The answer is C. Restrict high protein intake. A patient who is being scheduled for open reduction internal fixation is interested in knowing the details of the surgery and insisting on the nurse to explain the procedure. Which of the following nursing intervention is the most appropriate? A. Assess anxiety level. B. Assure he will be better after surgery. C. Explain the surgery. D. Give patient some sedative medication. The answer is C. Explain surgery. A 45-year-old man is admitted to the neurosurgery ward for the surgical elevation of depressed skull fracture. He has episodic severe headache with seizure and is unable to concentrate. Which of the following initial nursing problem needs more attention? A. Disturbed coping and anger spells. B. Risk for injury to seizure. C. Disturbed communication and irritability. D. Pain management and comfort measures. The answer is B. Risk of injury to seizure. A mother of a patient who is on antipsychotic drug asked a doctor about some more details about the drug. The doctor told the mother that her son is taking an atypical antipsychotic drug. Which of the following is the examples of this type of drug? A. Thioridazine. B. Clozapine. C. Chlorpromazine. D. Haloperidol. The answer is B. Clozapine. A cardiac care unit nurse decides to gather relevant data about the myocardial infarction patient who has breathing difficulty and severe bradycardia. Which of the following would be the most relevant and suitable database? A. Focused. B. Emergency. C. Complete. D. Follow-up. The answer is B. Emergency. A nurse measures blood pressure of a patient admitted to the male medical ward for 3 days. Which of the following is the best method to ensure that the nurse reading is reliable and accurate? A. Checks patient's blood pressure every shift. B. Measure patient's temperature. C. Document result in the chart. D. Measure patient's heart rate. The answer is A. Check patient's blood pressure every shift. In the pediatric ward, a newly registered nurse observed that most of the patients have respiratory problems. Which of the following conditions needs priority of care? A. Pneumonia. B. Epiglottitis. The answer is B. Epiglottitis. Epiglottitis is an inflammatory condition of the epiglottis and or nearby structures including the arytenoids, aryepiglottic folds, and vallicula. Epiglottitis is a life-threatening infection that causes profound swelling of the upper airway, which can lead to asphyxia and respiratory arrest. New questions and key points. What are the most common causes of death in Saudi Arabia? Cardiac arrest causes in traffic accident. Sinusitis, avoid travel with airplanes. Saudi Arabia neonatal screening for hypothyroidism. Cervical dilatation is the active phase of the first stage of labor, 4 to 7 cm. Transformational leadership. Definition. Leader that causes change, individual and social system that enhance motivation, morale, and performance of followers. Rheumatic fever, the medication is penicillin. Influenza in Hong Kong and killed millions of people, considered as epidemic disease. Tuberculosis is caused by Mycobacterium tuberculosis. Which of the following is not considered as an obstetrical emergency? A. Ectopic pregnancy. B. Placenta previa. C. Placenta anterior. D. Eclampsia. The answer is C. Placenta anterior. Doctor order 0.125 milligram. The available is 0.25 milligram. Capsule. How many capsule the nurse will give to the patient? Half capsule. The patient with burn at the right forearm, the face, and both legs anterior. The weight is 62 kilograms. How to calculate fluid requirements for the patient according to Parkland formula. Formula is 4 times weight of the patient and times total body surface area. The 4 is constant times 62 is the weight times 27 is the total body area equals 6,696. The causes of spontaneous abortion, congenital anomalies. Which of the following condition would be the most appropriate care for the telemetry unit nurse? New onset of atrial fibrillation. Basal skull fracture sign, raccoon eyes. Vitamin K dose of 0.5 mg for preterm, 1 mg for full term. What is the example of primary prevention? Given education on HIV to high school students. Doctor ordered to give 1,000 ml over 4 hours. What is the rate? The answer is 250 ml per hour. The nurse planned community program to those who experience a disease and assess the recovery or rehabilitation of disability. Which level of prevention? Tertiary. The IQ is mild retardation characteristic. Can learn some of daily life activities but still needs help. An IQ of 45 considered moderate mental retardation. Which patient the nurse should see first? Patient with potassium level of 7.5. A 95 mask is used for airborne. Hemorrhoidectomy intraoperative position, left anterolateral position. HIV patient will be risked for which of life-threatening disease? Tuberculosis. HIV weakens the immune system, increasing the risk of TB in people with HIV. A couple has a son and daughter and both move out and got family on their own. Which type of family structure? Blended. The site of the Weber test, middle of the forehead. Site of the Rhine test, mastoid bone. SIDH or syndrome of inappropriate antidiuretic hormone. The nursing management is fluid restriction. Sharp containers for needles and sharps only. Patient blood pressure of 142/88. What is the pulse pressure? The pulse pressure equals systolic minus diastolic. So 142 minus 88 equals 54. A client is diagnosed as having secondary Cushing syndrome. The nurse knows that the client has most likely been taking with medication, prednisone. When caring for a 3-day-old neonate who is receiving phototherapy, to treat jaundice, the nurse is in charge would expect to do which of the following? Check the vital signs every 2 to 4 hours. Patient presented with high fever, headache, vomiting, and neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for the patient? The answer is lumbar puncture with CSF aspiration, rationale, meningitis. A newborn Apgar score at 1 and 5 minutes is 5 and 10. Half an hour later, the baby become bluish in color with heart rate of 140 beats per minute. Your first action would be give oxygen immediately. A 68-year-old woman diagnosed with thrombocytopenia due to acute lymphocytic leukemia is admitted to the hospital. The nurse should assign the patient to private room so she will not be infected by other patients and healthcare workers. A patient complains of severe pain, which he stated as 9/10. The physician ordered morphine 50 mg IV every 4 hours. The last dose was given 2 hours ago. What is the best action? Inform the doctor to change the order. Which of the following is the best method report on issue to decrease confusion and irritability for asthmatic patient? Give oxygen. On arrival, she had severely decreased level of consciousness. Her breathing is shallow and irregular. The skin is cold, dry, and pale. There is generalized non-pitting edema of all extremities and face. The blood pressure is 70/40 mmHg. Heart rate is 60, respiratory is 12, body temperature is 35. What is the most appropriate method to rewarm this patient? Cover the patient with hospital blankets. During the evaluation at a community clinic, the patient completes the medical history. Which of the following is not a risk factor for an acute myocardial infarction? Hemophilia. An adult patient complains of diarrhea, vomiting, abdominal cramp, and pain within the past two weeks. The patient reported that the pain increases when she eats and relieves when he passes stool. Which of the following may be the cause? Crohn's disease. Measles isolation. Period of 5 days after rashes appears. In rubella, isolation. Period of 7 days after rashes appears. Different between measles and rubella is spot fever. Rheumatic fever test. Anti-streptolysin test. Uterus size after delivery, 900 grams. Adult CPR, 3:2 and 100 at 5 cm. Braxton Hicks contraction is a false labor. In false labor, contractions are irregular and do not produce dilatation, effacement, or descent. Influenza in Hong Kong and killed millions of people. Epidemic. Otitis media surgery, laryngotomy. Vaccine refrigerator temperature, 2 to 8. Pap smear test should be done every 3 years. An older adult client with history of blood clots is in the emergency room with suspected deep vein thrombosis of the left leg. The nurse starts IV heparin as ordered. Which of the following is least likely to be included in the care plan? A. Ambulation as tolerated. B. Warm, moist soak applied to the affected area. B. Analgesics as ordered. D. Anti-embolism stockings. The answer is A. Ambulation as tolerated.